This flower will stop a human heart. It is also the oldest heart medicine still used anywhere in the world. The only thing separating those two facts is a dose, and in the 1770s nobody on earth knew what that dose was. Finding it took one man 10 years and 163 patients, and he wrote down every single one who died. Almost none of that is the story you will find if you go looking. The version in circulation was drawn by an illustrator for an advertising campaign in 1928. We will get to her. First, the reason any of this mattered. 18th century physicians called it dropsy. A patient would begin to swell. First the ankles, then the legs, then the abdomen, until the body was carrying liters of fluid it could not shed. Breathing became difficult. Lying flat became impossible. It was common, it was visible, and it was very often fatal. What those physicians could not know was that dropsy is usually not a disease at all. It is a symptom. In most of those patients, the heart was failing, and the fluid was backing up behind it. Nobody knew what caused it. That mattered, because the thing that eventually worked was not aimed at the swelling at all. The heart is a pump in two halves. The left side drives blood out to the body. The right side receives it back and sends it to the lungs. When the pumping weakens, the problem is not only that less blood goes forward. It is that blood queues up behind the pump. Pressure rises in the veins returning to the heart. And when venous pressure rises far enough, fluid is pushed out of the smallest vessels and into the surrounding tissue. Gravity decides where it collects. In someone upright, it gathers at the ankles first, then climbs. Lying down, it redistributes toward the lungs, which is why these patients could not lie flat without feeling they were drowning. They were, in a limited sense, correct. So the swelling was never the disease. The swelling was the visible downstream evidence of a pump that had begun to fail, and every attempt to drain it treated the puddle rather than the leak. 18th century physicians had no treatment for that. They had theories, and they had the tools of the age. Bleeding. Purging. Blistering the skin. Draining the fluid directly through an incision, which relieved the swelling for a time and did nothing about the cause. None of it reached the pump, because nobody had identified the pump as the problem. The man who broke it open was not looking for a heart drug. He was not really looking for a drug at all. William Withering was a physician in Birmingham. He was also, and this matters, a serious botanist. He wrote a 400-page work on British plants. He was the kind of man who could look at a hedgerow and see a catalogue rather than scenery. In 1775, he was asked for his opinion on a family recipe for dropsy. In his own account he describes it plainly. It had, he wrote, long been kept a secret by an old woman in Shropshire. The recipe contained something in the order of 20 different herbs. And Withering, being a botanist, did the thing a botanist does. He read the list, and he worked out which ingredient could possibly be doing anything. It was the foxglove. Here is where the story stops being folklore and starts being work. Withering did not simply prescribe it. He began recording. Which patients received it? What form it was given in? What happened afterwards? Whether they improved, whether they did not, and whether they got worse. He kept this up for 10 years. When he finally published, in 1785, the book contained 163 cases. Not 163 successes. Cases. He included patients who did not respond. He included patients who deteriorated. He included the ones where he had, by his own reckoning, got it wrong. That sounds unremarkable now. In 1785 it was close to unheard of. The convention of the era was to publish the cures and stay quiet about the rest. A physician's reputation rested on his successes, and there was no mechanism and no expectation that anyone would report the patients who did not recover. Withering published the failures because the failures were where the information was. If a remedy works in some patients and not others, the useful question is not whether it works. It is which patients, in what state, given what preparation. You cannot answer that from a list of triumphs. You can only answer it by putting the successes and the failures side by side and looking for what separates them. That is not far off what a clinical trial does. It has no control group, no randomization, and no statistics, and it would not satisfy a modern journal for a moment. But the instinct underneath it, that a treatment must be judged against its own failures rather than its best days, is the instinct the whole of evidence-based medicine is built on. And there were a great many failures, for a reason that would have ended most investigations there and then. Foxglove is a poison. The gap between a dose that helps and a dose that kills is narrow. There was no way to measure the strength of a preparation. Leaves picked at different times of year carried different potency. Dried differently, they behaved differently. Withering worked out that the leaf had to be gathered at a particular stage, dried a particular way, and powdered, simply so that one batch resembled the next. Then he had to find the edge of the dose. And the only instrument available for that was observation of the patients themselves. He described what too much looked like, and the description is worth hearing in his own words. The foxglove, when given in very large and quickly repeated doses, occasioned sickness, vomiting, purging, giddiness, confused vision, objects appearing green or yellow. Increased secretion of urine. Slow pulse, even as slow as 35 in a minute. Cold sweats, convulsions, syncope, death. Every sign in that list is still recognized today. The slow pulse. The disturbance of color vision, objects taking on a yellow cast, which is still taught to medical students as a classical sign. He catalogued the toxicity of a drug 240 years before anyone could measure its concentration in blood. So that is the real story. A decade. 163 patients. A poison mapped by hand, by watching people, and written down honestly, including the parts that made him look wrong. Which is not the story that survived. Remember the illustrator. If you have met this story before, you have met her. Mother Hutton. The old herbalist of Shropshire. In the usual telling, she is a renowned folk healer. She cures the dean of Brasenose College. She takes Withering under her wing, teaches him everything, and he walks away with the credit for her knowledge. It is a good story. Better than good. It feels like a correction, a woman's expertise erased by a professional man, finally being put right. She never existed. Mother Hutton was created in 1928 by an American pharmaceutical company called Parke-Davis for an advertising campaign. They commissioned an illustrator to paint her. They ran her in their marketing. The company sold Digitalis preparations, and a folksy origin story sold Digitalis preparations rather well. There is no Mother Hutton in Withering's writing. There is no record of him meeting any old woman at all. Now, be careful here, because the correction has its own trap. Withering genuinely did credit a Shropshire recipe. That line is his, in his own book. What was invented was everything built on top of it. The name. The face. The friendship. The mentorship. A single passing sentence in a physician's account was inflated, 143 years later, into a character, by a company with product to move. So the folk origin is real, in the narrow and unglamorous way that real things usually are. A recipe existed. Someone knew about it. Withering said so. And then a marketing department gave her a name. What became of the plant is the part nobody disputes. The active compounds were eventually isolated. One of them, digoxin, is still prescribed. It is the oldest cardiovascular drug still in clinical use anywhere. Its use has declined over the decades as safer alternatives arrived, and it now occupies a narrower role, in particular patients with heart failure and with atrial fibrillation. It also still causes poisoning. The narrow margin Withering spent 10 years mapping by watching people is narrow still. We simply have blood tests now. 2 stories came out of one flower. In one, a wise woman hands down ancient knowledge and a doctor takes the credit. In the other, a botanist reads a list of 20 herbs, picks the one that could be doing the work, and then spends 10 years writing down every patient it failed. The first was drawn by an illustrator in 1928. The second is still on a shelf, and anyone can read it. This channel deals in what the body actually does and how we found out. Nothing here is medical advice, and nothing here describes a treatment. Speak to a qualified clinician about any health concern.